Privita. Okay. Privila. Okay. Sorry.
She was a PG. She accidentally got into this section.
Good afternoon all. Here I share our experience with enhanced depth of focus intraocular lens. I have no financial interest or relationships to disclose. Cataract surgery these days is justifiably considered as a refractive procedure. We have our traditional monofocal IOLs which give us good distance vision, but spectacles were needed for near and intermediate vision. Then came the multifocal IOLs which provided good near vision, but that was at the expense of reduced contrast sensitivity and presence of glare and halos. Then came the trifocals which provided good near and intermediate vision, but again there was a problem of reduced contrast sensitivity and presence of glare and halos. Then, with the advent of technology, enhanced depth of focus IOLs were created, which gave fairly good distance vision, usable intermediate vision, functional near vision, and it was without much photic disturbances. A few words about the optics of the EDOF. The basic optical principle is to create a single elongated focal point to enhance the depth of focus. This elongated focus is introduced to eliminate the overlapping of near and far images caused by traditional multifocal IOLs, thus eliminating the halo effect. In this picture, you can see instead of a focal point, there is a focal line, and even when focusing for near, that a part of the focal line is on the retina. But physics precludes the creation of an ideal EDOF lens. So what can we do? There are various technologies to confine the emerging rays through this channel before reaching the retina. So Alcon has come up with a new technology which is called as the X-wave technology or the wavefront shaping technology in their new diffractive EDOF IOL. These transition elements are incorporated into the anterior surface of the IOL. This is surface transition element 1, which is an elevated plateau which stretches the wavefront, and then it can focus for a continuous range of distance. And the transition element 2 is a small curvatural change which shifts the wavefront so that the entire energy is confined within the EDOF channel, and this leads to decrease in glare and halos. These are the physical characteristics of the IOL, and here again you can see in the center 2.2 millimeter of the IOL, you can see the surface transition elements. And here in the case of a toric IOL, indentations are seen on the posterior surface and wavefront shaping technology is seen on the anterior surface, and you can see the markings on the flat meridian. Aim of our study was to analyze the visual outcomes with Vivity and Vivity toric IOLs after bilateral implantation in patients undergoing phacoemulsification surgery. It was a prospective observational study in 70 eyes of 35 patients who underwent uneventful phacoemulsification over a time period of 1 year. And patients with more than 0.75 diopter astigmatism, Vivity toric IOL was implanted. These are my inclusion criteria, and we have excluded patients with other ocular comorbidities with poor pupil dilatation and poor zonular support. All the patients underwent thorough ophthalmologic examination, and they were explained everything about the IOL. And in patients with more than 0.75 astigmatism, toric IOL was planned. All the routine preoperative medications was given. MICS was done through a clear corneal 2.2 mm incision. IOL was placed in the bag and was centered using Purkinje image. And routine postoperative medications were given. These are our outcome measures. On the first postoperative visit, we measured the uncorrected distance visual acuity. On the second postoperative measures, all these parameters were measured. Intermediate vision was measured with the help of a handheld ETDRS chart at 66 cm. On the third postoperative visit, again all these parameters were assessed. The data collected were tabulated in MS Excel and analyzed using IBM SPSS software. 70 eyes of 35 patients were included, and 60% of the patients were male. And Vivity IOL was implanted in 58 eyes, and Vivity toric was implanted in 12 eyes. Here from the graph you can see that the binocular distance visual acuity mean has improved from 0.488 to 0.19. But looking at the standard deviation, you can see there is moderate variability, which indicates that some patients still had suboptimal vision on the first day post-op. These are my outcome parameters at 1 month and 3 months. Here again the mean has improved with a very low standard deviation, which indicate fairly good outcome in distance vision. Then coming to the intermediate vision, here the mean is less, the standard deviation is very less, which indicate excellent intermediate vision. But in the case of near vision, even though the mean is less, the standard deviation is 0.12 and there is a wide variability between the minimum and maximum values, indicates that some patients still struggle with their near vision. We had 40% of patients who had vision less than N8. The visual and refractive results were quite promising in our study, and the patients achieved unaided vision at far and intermediate distance without significant visual disturbances. It also provided functional near vision. There was good contrast sensitivity and only one patient complained of intermittent glare post-surgery. The VT lenses can be positioned between monofocal and multifocal lenses, and it successfully restored the distance vision. Spectacle independence was high and it had monofocal light visual disturbance profile. It also provided excellent results in patients with associated astigmatism. To a single center study, and we did not study it on ocular comorbidities, so we don't know how it would perform. So it is the best IOL in patients who do not want visual disturbances. These are my references. Thank you.
So what is new? I think they would have done the study and then got approval, no? So what have you added to the literature?
No, it is actually it can be used in patients who who do not want any visual disturbances, like
I understand,
intermediate.
but that's why they got the approval for the lens, no? That's why it's been approved. So what did you, apart from repeating the what they've already done, what have you added? So you can say that maybe you've done it in the Indian eyes. That is one thing. Any other complications were there during surgery? Anything like that?
Actually,
post-operatively?
No such complications, sir. Only one patient was complaining of intermittent glare, but that patient had a very dysfunctional tear film also. So at times it was just intermittent glare, sir.
And any patient who are systemically, they were having diabetes or something like that?
Yes, sir. Patients had, but they did not have any difference, sir. It was like normal patients.
Because what happens is, that's why you get this issues of tear film issues, because diabetes, what it does is, it will split the epithelium and then the tear film will not be stable. So you have to look into that also. Anyway. Okay, thank you.